Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and happy Wednesday. This morning, I'm joined by Ashley Guthrie, who is with Bluestone Physician Services. Good morning, Ashley.
Good morning.
How are you today?
I'm good. How's it going?
Good, good. So my background matches your shirt. See what we did there?
Yes, I love the light blue for Bluestone.
That's right. So Ashley, for people who haven't maybe met you yet, because I know you're newer to Bluestone, we would love to get to know you a little bit better. Tell us about yourself and your background.
Sure. So I'm actually from Sarasota area. I'm born and raised, and I went to school here. I went off to college in Orlando, got my double majored actually in healthcare administration, health sciences preclinical. Thought I wanted to be a PA, decided med school was not for me. And business way was more my route, what my expertise was. I was working up there at Florida Hospital Medical Group, which is now Advent Health. Moved back home to Sarasota, missed the beach way too much, and my family's here. So I actually was working with Sarasota Memorial Outpatient Rehab for a bit, and then decided to go back to school. Got my MBA at UF, specializing in marketing, and was out of the field a little bit while I was in school. And now I just got back into it with Bluestone. I'm very excited to be a part of such an amazing company. I believe this year was the best place to work for 2020 for the 8th year in a row, which is amazing. And it showed. I've only been in the position for about a month now. And Terry, who's our market director, has been amazing training me.
Terry is amazing. I remember the first time I met with her, we went over to a buttermilk restaurant over in Sarasota.
Yeah, so good.
Yeah, oh my gosh. For anybody who's watching, not to be like plugging a restaurant during our session, but buttermilk is amazing. But yeah, instantly we clicked, and I love what you guys do. I had experience with Bluestone before I was with Blue Book when I was working at an assisted living community. Tell people who haven't heard of Bluestone exactly what you guys do.
Yeah, so we provide on-site primary care in mostly ALFs, independent living, and memory care units. So all of our providers are mobile. We do not have a brick and mortar facility. We go to patients instead of them coming to us. So all of our providers are very familiar with the regulations in these assisted living facilities. They're well trained, and most of them live locally. So that way it's more convenient so that they can stop by buildings. Their max census is typically 200 to 240 patients, so they can give quality care to the residents and the staff. Our residents and patients typically have 4 or more chronic conditions, so they're especially at risk right now. So if they were to leave their homes or to go to the doctor's office or hospitals, we prefer them obviously to stay home, to stay in the facility that they're staying in, so we can come to them and serve them where they're at.
Absolutely. And one thing that makes you guys really different is you have this online portal. It's called the Bridge. Tell us about kind of how this works and how this really helps, of course, the physicians and the communities connect, but also the quality of patient care that you're delivering.
Yeah, so our CEO, Dr. Sivlin, worked with the team to create this we call the Bridge. So it essentially bridges our community staff, our family members, our providers, all on one portal. It's as easy as sending an email. It's a secure, HIPAA compliant portal where they can all just communicate. So the ALF nurse knows what the physician is writing orders from, and the hospice nurse knows what the ALF staff nurse is doing. So it's more of a coordination of care and continuity so that there's no gap. Everyone knows what's going on, even especially now family members, if they can't go to visit their mom and dad, they know what's going on, even though they can't be there.
It's so important right now, because I know I don't know. I can't imagine what families are going through right now, not being able to hold, to touch their loved one, unless they've gotten creative at the community with the hugging booth and things like that we've seen. Or the lady that became a dishwasher at a community to be able to see her husband, right?
Yes.
But I know the online portal, even going back and having experience with it, it really, it just enhanced that residents' quality of care.
And it's so easy to use. Yeah, we really encourage, obviously my job, part of my role is to get our facilities on board and our staff. And once they figure out what it is and use it, they're like, why isn't everyone doing this? It's like, that's my goal. So
exactly.
Well, and especially right now with COVID, we're trying to, our patients and our staff, their safety remains our top priority. So we've partnered with a lab that provides testing for our providers weekly. So after rounding each week, they get swabbed, that fun nasal swab right up the nose, and we get our results back within 48 hours. So that they'll be able to start rounding that next week, and we only have them go into one building a day. And the rest of the patients they see through telehealth, which has been a huge, huge development over these past few months.
I remember in the beginning when all this was starting, Terry had sent me the press release that you guys were starting that telehealth. And I feel like you guys were already like months almost ahead of this curve of kind of people. Obviously, this is what we've had to pivot to for health. And so that's amazing that you guys had already thought of it, or you were working on it before even this all happened.
Yeah, definitely. Bluestone has been very innovative in that way. So I'm very grateful to be for a company that is kind of ahead of the game. We're already starting to plan out not only 60, 90, but a year from now, what it's going to look like. We just don't know what tomorrow's going to bring, when a vaccine is going to happen. So we got to prepare for it so that our patients can still receive the best care.
Definitely. And one of those things that you guys have done too is you've added on a new role called a post-acute care manager.
Yes.
Tell us a little bit about what that person does, their role, and just kind of how it's all connected.
Yes, so that role is based on territory. So same with my position, I'm mainly the Sarasota-Bradenton area. So we have Tracy, who's amazing. She's located in Sarasota area as well. She's what we call a post-acute care manager. So she is going to be monitoring trends, length of stay, frequent flyers. She keeps an eye on admissions and tries to reduce admissions. So part of our mission is to increase coordination and continuity of care. So we're able to track our patients while they're out. Like if they, for some reason, need to go to the ER, the hospital, we're still able to have those and build those relationships with the hospitals, the case managers in the hospitals or rehab centers so that we close that gap. Obviously, unfortunately, with healthcare, not everyone's on the same EMR software, so it's kind of a fragmented system. So our goal is to kind of bring that together, close that gap so that we know where the patient is at all times, what orders they're receiving, what medication the other physician is prescribing them, so that when they come back to the facility, we're able to maintain and be able to kind of know how to treat them so that they don't have to go back out.
Definitely. I love that new role. It's so important. And communication, like that's where you see in any business, like, or anything in general, like that's where things can fall through. So having that person be that extra, like you say, like that gap of communication is amazing.
Yeah, and it's going to take time. I mean, she's fairly new to the role too as well. So this is something we're going to be building a relationship over time with Sarasota Memorial, with Manatee, with Doctors Hospital, just so because our facilities are everywhere throughout Sarasota, Manatee County. So we're trying to build as many connections as we can so that we're able to reach out and say, hey, we know this patient came to your hospital. We need to know, sometimes they don't even get the discharge summary. So these are things that we're trying to obtain so that when they go back to the facility, that they have all the information that they need.
Definitely. And for those that are, we get a lot of professionals too that watch these lives. Are you guys able to, like if there's a building, whether they're a new building or existing, are you guys right now able to provide physicians to go into those, to kind of build those new relationships?
Yes. So right now, we are providing what we call telehealth urgent care visits. So even if you are not a Bluestone patient, we're still able to see that patient. Which has been very beneficial. Obviously, with COVID happening and people not being able to go out of the facilities, we come to them. It's sometimes hard to break that bond between someone's primary care physician, and this kind of helps more of a segue of getting comfortable with another doctor and saying, oh, like this, why wasn't I doing this before? They come to me, I'm not risking my life leaving the facility. and they're able to treat me where I'm at.
That's awesome. That's awesome.
Yeah. Yeah.
And what's the best way? Would they connect with you, Ashley, or if somebody did want some more information about Bluestone, how do they reach you?
Yeah. So I'll give out my cell, and then I also think you'll share my email information too.
Mm-hmm.
So it's 813-459-8165. When I first started, I have two phone numbers, obviously my personal cell and then my work phone, and I was accidentally giving out my personal cell, so I had to remember that number.
It happens. Yeah. And yeah, I'll share your email. We'll share too, like if there's a somebody watching that wants to become a patient of yours.
Mm-hmm.
I know there's another kind of phone number on the website that's listed, so I'll make sure to include all of that on the post.
Yeah, we have a whole enrollment team that takes care of that, so that it's as quick as possible. We can see a patient within 24 to 48 hours. So we try to really, of course, make sure the insurance is accepted and then kind of move forward with the care. We also are providing, on top of those urgent care visits, testing if need be. So if your community, staff, obviously the residents need to be tested, new admissions, we're offering that service as well. And then we also have an immunization clinic that we're offering in a couple of months. We're partnering with CVS to be able to do shots because, of course, unfortunately, we're already coming into flu season, and that's something that we'll need to address.
Definitely. Well, that's awesome. You guys are doing such a phenomenal job out there, and it's so nice to be able to connect with you. And for those that are listening that are professionals as well, please connect with Ashley. Like she said, she's a month new to this, but I feel like you've been doing it for years, just the way you speak about it. You're a perfect addition to their team there. And any last words of advice for people that are listening?
Just stay positive. I think it's all, a mindset right now of having an outlook, because I do see the light at the end of the tunnel. I think things are going to get better. So I can't wait till then. I mean, I joined this position during a global pandemic, and this is all I know. So I think it can only get better from here.
Definitely. Well, thank you so much for your time today. It's so great to get to know you better, and looking forward to all the stuff, the good things to come. Like you said, good vibes. Everybody stay positive. We've all got this together. So reach out to Ashley and Bluestone. And Ashley, I hope you have a great rest of your day.
Thank you so much, Brittany, for your time. And thank you, Senior Blue Book.
Absolutely.